Hello, and welcome back to the Empowered Nutrition Podcast. I really am honestly serious to say that this might be one of my top most excited guests I've ever had on the show. Welcome, Dr. Barrie Tan. How are you?
I am well, thank you. Glad to be on your show. Hopefully, this will be greatly beneficial to your listener and me. This is a wonderful time we can do this because it's a few days before the big holidays.
Yes, yeah, exactly. We're recording right before Christmas, which I'm so
Yeah.
thankful you made time because, to be honest, I'm a second career dietitian, and what really stimulated me to leave my career as a military officer is that I had been eating kind of the dietary guidelines recommended sort of low fat diet for a long time and had quite a
Mhm.
lot of health problems that I thought maybe I needed to follow even closer on that. And then I got persuaded to try out a diet that was like dramatically different. It was basically like an ancestral model type diet, and really experienced a dramatic improvement in my health and started to research more into the world of like especially Weston A. Price. Around that time I was doing a lot of research there, and just realizing the power of fat soluble vitamins is what persuaded me the change, because I think what what like, actually it's kind of interesting that we're meeting today, because I just saw in the news today that other wealthy countries in the world are experiencing an improvement in their longevity. Americans, even after the COVID recovery, have still, now that they just announced today, are still experiencing a decrease in their lifespan and their life expectancy. And my honest belief is that a huge part of American longevity is that we suffer in the space specifically of fat soluble vitamins. And that is the most misunderstood thing that people get confused on. I literally just had pushback somebody today that got one of my free handouts. And she said, I can't believe you recommend that people eat um, dietary fat like from animals, like lard, for example. And like it's all about fat soluble vitamins. And so you're one of the world's most renowned experts in vitamin E, which of course is a fat soluble vitamin. And
Mhm.
I think even more among the fat soluble vitamins critical to talk about, because I think a lot of people and even practitioners are really scared of vitamin E, because there's been research that has come out and has said that, okay, vitamin E, when we take a cohort of people and they supplement with vitamin E, they actually have worse health risks than if they didn't supplement. So maybe we can start with that. Maybe tell me a
Yeah.
little bit about what happened with that research, and like, should we all be scared of vitamin E?
Yes, yes. Thank you for that intro. Yes, I've spent my entire adult life studying fat soluble vitamin. Now, if the audience want to know why I mention fat soluble, vitamins are chemicals. They are chemicals our body need, small amount, and the lack of it will cause a disease. I'm just trying to give you the simplest way to understand things,
Mm.
but it's something not our body makes. We only need tiny amount. And then water soluble just mean that if you put it in a glass of water, it'll just dissolve like that. If it's oil soluble, you put it in a glass of water, it'll float to the top. That's it.
Mm.
That's an understanding of it. Now, when it gets into the body, a water soluble would be B vitamin, and vitamin C that would be water soluble. You can see that it tastes acidic. Vitamin C,
Mhm.
like that, and those are important, but they're water soluble, and you don't need to have fat, and so therefore, if you eat citrus like oranges, apple, you'll get those vitamin C because they're water soluble. Just as a background,
Mhm.
oil soluble things are made by the plant. They are found in oil and fat, even intuitively. That first off, to let people know, plants never make things for human beings. We just got to somehow they make it for us. They make it for their own survival and their own preservation. So if you find vitamin E in fat and oil, so one simple guess would be the plant makes it so that the oil in the plant would not make it go bad and go rancid and
Mm.
go rotten like that. Hence, vitamin E is found in soybean oil, it's found in corn oil, like that. Now, other people say, oh, soybean oil, corn oil are no good. I know that's a different discussion, but yes, correct. Because of the
Mhm.
huge amount of this kind of vegetable oil we consume. But
Right.
otherwise, vitamin E are found in vegetable oil to protect the oil so that the fruit or the thing that it comes from will not go bad. Animal eat this kind of corn, and therefore they will then store it in their fat deposit because they eat it from the plant. So, hence, like otherwise, animal does not make vitamin E is entirely from the plant. That is the background. In the 1990s to the year 2000, there was a large Harvard study funded by the US government, and they are called the health professional, health nurses and doctors, because the study was 30,000 people, and then it just logistically hard to get that many like
Mhm.
that. So they did that study, and it was kind of like a 10-year long study. When the study came to an end, they had initially hypothesized that vitamin E being an antioxidant, and if you let people have it long enough, then they will protect them from chronic conditions.
Yeah.
Chronic conditions such as women, health professional women not having breast cancer, men doesn't have heart attacks, to come, and then both men and women don't have type 2 diabetes, things like that.
Mhm.
Then, when 10 years approached, they found out that they were possibly, and it did no good at best. Then I said,
Yeah.
sound bad. So at best, it did no good, and at worst, some women who took the vitamin E may possibly have increased breast cancer, and men may have increased prostate cancer. And then I said, oh my goodness, this is bad news. Now,
Mhm.
at the time, I was a young assistant professor at University of Massachusetts. I had already started to do tocotrienol, which is really at its infancy. So and then I thought, oh, I am going to be like a baby thrown out with the bathwater because I'm studying this tocotrienol vitamin E, and now they talk about the vitamin E was alpha tocopherol, the most famous.
Yes.
If you look on your cereal box, you say you're with the military folks, on the cereal box, it'll list on it. So that
Mhm.
vitamin E would be alpha tocopherol, the common one. Then somehow inside me, and not all the things in my discovery are entirely scientific. Some of them are intuitive. We're human beings. We have things, we feel things, we have certain understanding. This can't be it like that. So I had that sense. At the time
Mm.
when I was studying tocotrienol and in cancer, and tocotrienol in lowering cholesterol, which is not really antioxidant like that, but I studied those things. So somehow I thought something is different. I persisted, and I'm glad I did. If I didn't, I would have lost all the understanding that I had gained in the last 30 years. And of course, you and
Yeah.
I know hindsight is always 2020, but that was the reason. So if the audience were to Google vitamin E and negative thing, they're gonna pick up all this news. They came out roughly late 1990s all the way into 2000. I continue
Yeah.
to put my finger on them, and sometimes people still studying them. And every time when those bad news come out, it refers to the most common vitamin E, and that would be alpha tocopherol. And frequently they're synthetically made. They're made from petrochemical source, not from natural one, anyways.
Yes. Yes. So beautiful. Thank you. So basically, within vitamin E, we have tocopherols, which are the common and often synthetic vitamin E that was in these studies that showed to have maybe neutral or even a negative health impact. But what you're talking about is you have studied tocotrienols, which are another really class of vitamin E compounds. And maybe tell me a little bit about the research that you've been able to publish and that you've seen published on tocotrienols in terms of like what problems have you seen that those can help improve?
Okay. I think one good way would be I show you through this example here. I know it's a bad analogy. If you think of a tocopherol, it
Hmm.
would have a head and then a tail. Just think of a vitamin E molecule looking like a sperm or a
Hmm.
tadpole, something like
Hmm.
that. Has a head and a tail.
Hmm.
And then the tail of a tocopherol is longer.
Hmm.
And if you think of a cell that look like this, like a bean shape, a
Hmm.
cell can, even if you don't know a lot of other details of a cell must have a cell wall. to
Mhm.
contain the nucleus. They make you look like your parent and me look like my parent because they have DNA inside. And then they have other things inside the cell, like mitochondria that makes energy so that we can live every day, and other stuff that you sometimes hear people talk about: Golgi apparatus, endoplasmic reticulum. All these stuff are inside every cell. There is no cell that I know of that does not have a cell wall. It must have a cell wall. So I think of the cell wall as a gated community. If the gated community does well, nutrients goes in properly, and then the waste go out. That is how it works. And if the gated community is dysfunctional, everything you can imagine will be problematic because everything goes to the gate. For example, if you eat food that converts to sugar, the sugar is not supposed to stay in your blood infinitely. It's supposed to be there only for about 2 hours, and it's supposed to go in the cell. So when the sugar, which is a big blob of molecule, come to the cell, how is the sugar going to get in? So there must be some gated community here,
Mhm.
receive the sugar, understand that this is sugar, and then the sugar slips in. Otherwise, it won't go in. So then all that to say, a good gated community works.
Mhm.
So this tocopherol that go in is one
Mhm.
of the perfect molecule that slip into the cell. You have to try to imagine the cell wall here. It slips in here.
Yeah.
So it got the longer tail. So it anchors deeper into the phospholipid, the cell wall. The 80% of the cell wall is fat. Remember you mentioned fat
Mhm.
soluble, 80% of the cell wall is fat, and
Mhm.
it goes in. And every one of the audience probably hear one too many times on the word antioxidant. I'll give you the bottom line on antioxidant. It's because everybody is saying that their chemical and the grandmother's dog is an antioxidant. It's just too much, you know. So I'm lost in translation. But the antioxidant that the audience should be interested in is this. Think of a hot summer day. You drive past a roadkill. That smell. Think of you putting a stick of butter or margarine on a hot porch and then come 2 hours later and then you smell with that smell. That smell. That is to tell you that the roadkill and the stick of butter smell are the off smell because of the oxidized fat. So
Mhm.
fat oxidation is it goes bad, rancid. It's the
Yeah.
first thing to go bad. So inside the body is the same. Why is that the same? Because we need oxygen to live every day. We cannot stop breathing every day. So 1 in 10,000 oxygen go wacko. However, the 999 over thousand that works in the body to give us energy, to breathe, to do the whatever like that. So in the one that goes bad in 10,000, this vitamin E molecule, when it comes to the cell, it traps the oxygen, and the oxygen will not destroy the fat in the cell wall. That is supposed to give a good gated community. A tocotrienol look like this.
Mm.
See, the tail is shorter. The tail of the
Smaller.
tocotrienol is shorter, so it anchors less deeply into the cell wall. So
Mhm.
the if you think of the cell wall here again,
Mhm.
the tocopherol move around the cell wall like this
Mhm.
because it's anchored deeper, doesn't move as fast. The tocotrienol flies around about 50 times faster because the tail is simply shorter, like that.
Yeah.
So they are both catching the bad guys. A tocopherol will act like a policeman, stay in this city, stay in the town. A tocotrienol will behave like a state trooper. It covers the entire state. I think they're both
Oh.
catching the. So that is how I explain it. And I happen to have a molecule of tocotrienol here.
Yes.
So like that. If I purposely go off screen, that
Uh-huh.
it this head here, that's it. This one here, that's the OH, the antioxidant.
Uh-huh.
And if I go on the other side, see,
Uh-huh.
that is the whole tail. See that?
Yeah.
The
Uh-huh.
carbon is the a black color. Hydrogen is the white color. So if this thing sticks in, or if I go like this, sorry, I go like this sticks in into the cell
In the
membrane,
membrane.
and then this one is outside, so that
Yeah.
if it's oxygen come, this will go after the oxygen. That's it. So the shape of the antioxidant have to look like a tadpole or a sperm, and then it
Yeah.
would work. And of all the antioxidant, there are probably 10,000, 20,000 antioxidant chemical known, but few 0.001% of them actually are situated and live inside the cell wall. And the
Yeah.
cell wall is the one that need protection. Now I give you another simple example. If each of us have about 25, I'm not making a judgment, just of average person,
Sure.
25 to 30% fat. So if the person is about 150, 160 pounds, so we'll carry in our body about 30 or 40 pounds of fat. If we are athletic jog, maybe more like 30 pounds. You have to be a fantastically lean person to have 20 pounds of fat. Less than 20 pounds of fat is dangerous because once you get sick, you begin to lose fat and then you become skeletal. Not good
Yeah.
idea. That
Yeah.
but
Yeah.
of course, we worried mostly on the high side that we don't want to get understood. So,
Mhm.
of those, say, average 40 pounds of fat, most of them are in the cell wall. It's not in your love handle. You cannot see it ever because it is in the cell throughout your body, your hair, your skin, your nail, your face, your body, your organs, everything. So you can't, it's everywhere because they are all made of cells. It is because of that antioxidant become important even if we are not disease stricken. It would be just to protect the cell so
Yeah.
you have a great gated community. A great gated community will
Mhm.
allow nutrients to go in and then waste to go out. If you have that understanding and metaphor, you will not go wrong. And when scientists mumble this, that, and other thing and lost in translation, you don't know what
Mm.
they're talking about. So this is a simplistic thing and it actually works.
Okay, so tell me if I got this right. So you've got antioxidants, and like a lot of them won't even attach to the cell membrane at all. And that's a problem because we have oxygen, which is an oxidative pro inflammatory stressor that needs defending. Otherwise, it'll oxidize the fat in our cell membranes, which is like what your analogy about talking about, like rancid food, for example, is also oxidized. And we have health risks that come from having oxidized fat in our bodies, and those can include like metabolic conditions and cancer and heart disease risk and diabetes, for example. So we want to protect against that oxygen. Most antioxidants aren't going to hang out in the cell membrane as an ongoing defense. um Tocopherol, it sounds like, will go in the membrane, but the head that sticks out is not as effective, whereas with tocotrienols, that that sticks out of the membrane is actually more effective at moving around more and attacking more oxygen molecules and free radicals. Is that right?
You got it spot on, Aaron, and that,
Okay.
that is right. So, and it is just by virtue of the and when this molecule through the eons of time that was made, it was made by the plant in order to protect the plant that stores a lot of fat for its own procreation. You see,
Yeah.
you notice that most of the fat, like if you have a soybean, the fat is kept in the soybean because if you ever germinate the seed, you notice that the plant can germinate without nutrient initially, and it
Mhm.
will draw the nutrient and the fat from the cotyledon, from the
Mhm.
seed, like that. Like just think of peanut. We all eat peanut except if we have peanut allergy. So
Yeah.
the two cotyledon there, that's where the fat is. So if you
Mhm.
were to germinate a seed when it grows, then all the food, which including the fat, will come from cotyledon and then go to the peanut, and then the peanut plant would grow up until it is maturing. Then you put it in a pot, and then you need external nutrient. Very simple. So
Mhm.
and they figure out a way to make a molecule called vitamin, what we known as vitamin E, tocopherol. They also make tocotrienol, and then to preserve the oil that is needed as a nutrient for the early stages of their growth. It's simple as
Yes.
that. Now that we are at this, the audience probably will want to ask me how to distinguish one from the other. It's very interesting. Most plants make tocopherol because they only need a small amount to make it good. But some plants specifically make a mixture of tocopherol and tocotrienol, and only one plant that I personally know that only make tocotrienol. So the moment they make, if they want to protect themselves, they make tocopherol. If they want higher protection, they make tocopherol and tocotrienol. If they want a very specific highest endpoint to make the most protective thing, then they make only tocotrienol, which is what I discovered about 25 years ago. And the last 25 years, committed like mad to do a lot of clinical study. First, many animal studies, and then to do clinical studies. So I'm grateful because next year I'll be 70 years old. So I don't know how long I'll be, but to the extent that I am actually committed to do this so that I can help other people to realize the benefit of what this compound can do to help people. And it is a vitamin, and it happens to be a fat soluble vitamin. So
Yeah.
I'm glad that you decided to touch on this for your audience. So it's wonderful.
Yeah, we need to talk about the benefits a little bit more, but really quickly, I think I have to ask you that clear the air on something. And what that is that I know for sure that I've been told multiple times, like with the vitamin E story, especially that the problem with vitamin E in terms of like why that research showed an adverse effect is this problem of like basically like down regulation of your endogenous antioxidant production. So basically, if your body senses a big influx of antioxidants from a vitamin E supplement, your body will respond with this negative feedback loop of stopping to make enough endogenous antioxidants, or like glutathione, for example. And that's actually the majority of our antioxidant defense is like endogenous production, maybe even more than like dietary intake. And so tell me, if is that all totally wrong, or if it's correct, why would it apply to like maybe not tocotrienols, and maybe kind of tell me your thoughts on that.
Okay, there are some animal study that went that direction,
Mhm.
Aaron, whereby when you take the tocopherol, the endogenous just mean antioxidants made inside your body go
Mhm.
down, and they are not a lot. While you add it, and if this it would be of education to you and to your audience, I can only think of about three, perhaps four. I'm sure when I think hard and crack my brain, I can think about it of three or four endogenous antioxidant, meaning antioxidant your body makes by itself.
Mhm.
Not a lot. Plant make a lot of antioxidant, but the human body make less. You
Yeah.
already mentioned one, glutathione, and then another one would be CoQ10.
Mhm.
Coenzyme Q10 is a
Yeah.
true antioxidant chemical. So glutathione, CoQ10, um, um, alpha lipoic acid. We make
Mhm.
very little of alpha lipoic acid, but we do like that. And then one that just about nobody ever mentioned it, and it's fantastic that when I first noticed it, the sex hormone of women, estrogen, is an antioxidant. Next
Mhm.
time, after you come, after you Google the structure of an estrogen, is an antioxidant. So that means, why did I make a point to say that? Well, she's fine in her entire adult life because her estrogen changes only in every 28, 30 days. But when it went to menopause and then it dropped precipitously,
Yeah.
that's when she had initially her symptoms would be hot flashes and feeling miserable, depression, and all these things. But when that comes down, her defense system is compromised. And
Mhm.
then she will begin to see other diseases and illness besides the few that is noticed during the, I call it the hot flash period, like that, they
Mhm.
go down.
Mhm.
That an example of that would be osteopenia, and that become osteoporosis like that. That cannot happen overnight. That happen over 20 years, and then before any bone will become fractured. So anyway, I'm already sidetracked. So that would
No,
be,
you're good.
because you mentioned glutathione, then
Mhm.
I thought of the other one. So we clearly need antioxidant to support ourselves because as we age, this thing make less.
Mhm.
If, for example, you are a beautiful young lady and you have about three children. So your things are your body system is too stable, but I'm on the other end. Or someday all of us will become 50 to 55 like that. And then that would also happen. So we wanted to be there and have the high
Yeah.
quality of life as we age. Not we want to have high years to live, but not the quality to go with it. And those things
Mhm.
cannot magically happen overnight.
Yeah.
Happen now. So if we take care of our body now in adult life for the next 20, 30 years, then we're actually investing for what is to come in latter years. These are actually all good. Luckily, I, I, I I did not know as much as I do now, but I was involved in nutritional studies mostly as a career. And who would have guessed I did that? Hey, this is actually good for my life. You see, nah, I didn't even think about it. I was just doing that because this is my scientific career. Then I said, hey,
Yeah.
if I follow through with this is a good thing. And right now, I'm great that I still have a good mind, even with my age. I do exercise and try to eat well because you mentioned. Anyway, back to the high fat thing. What? Tell me again now. What was the question you want to ask? I
Well,
already
I
missed.
think you've answered me in terms of, do we need to have this fear that if we supplement with antioxidants, it's going to backfire because our body will stop making antioxidants, and so overall we'll net less.
Oh,
But
okay. And
it's
also you asked, uh, what? Why did it backfire when people take high tocopherol? I think that the lowering of the total antioxidant status, that's one aspect. This high alpha tocopherol also mess around with the
mm,
signal of how the body signal, how the cell function like that. It also mess around the signal, and instead of helping, it got worse, despite the fact that it's an antioxidant.
mm,
I think the simplest explanation I can give to people is this: tocopherols and tocotrienols uh, are four tocopherols and four tocotrienol. Of the eight vitamin E, only alpha tocopherol is has a transport protein. When I say it has a transport protein, it just has something that hold on to that and take it into the cell. So it has the rite of passage.
mhm,
In a very simplistic term, like if you and I have a chance to be given a ticket to attend the Oscar, so we'll probably have to line up the night before because it's a first come first serve. If you and I were to be lucky to be Nicole Kidman, she will never need to line up. She would just have a rite of passage to go right through, like that. And
yeah,
of these, only alpha tocopherol have a rite of passage because of transport protein. You'll go through.
that's a
And
direct
so,
path.
in these large studies that they have this thing, and they gave people so much of this alpha tocopherol, and it all have a rite of passage, so they all glut in all over your organ, and then rather than doing good, it bore harm.
Mm,
On the tocotrienol piece and the other tocopherol, the other three tocopherol and the tocotrienol, they do not have a rite of passage. So they will do it through diffusion. So if any one of the
mm,
listener or their spouse are engineers, they'll know this. Diffusion means that you have a teaspoon of sugar, you put
mhm,
on a thing, you don't stir the sugar on a glass of water. You can see after a while the wiggly thing. So the sugar concentration will go on the concentrated one to the least concentrated one. That
mhm,
process is called diffusion. That's how tocotrienol works. It just diffuses
yeah,
from A to B to concentration. So that's not a rite of passage. That's just
mhm,
a concentration difference.
yeah,
So that process is safe, and that process is good as the body needs them, is used in different part of your body, again to protect and provide the good gated community I mentioned earlier. so,
okay,
so that so the main thing would be it actually, the alpha tocopherol has a transport protein, and it makes things worse because it grab all the vitamin E, and then the
yes,
vitamin E is stuck in the body everywhere, rather than it just gets stuck there rather than being washed out with what is not needed.
yes, okay. So, I believe that alpha tocopherol was used in these studies that had adverse effects. Is that correct?
Yeah, only alpha tocopherol. They never
Okay.
tested any tocotrienol. We
Mhm,
in the last 20 years have specifically tested tocotrienol, probably in about 5, 6 different conditions
Mhm.
over about 20 to 25 study. These kind of study takes a long time.
Yeah.
Besides a lot of money, a lot of thoughtfulness, how you design the study so that it's as good as it can be tank tight, and then making conclusion that is meaningful to the audience. So
Yeah, well, I guess I'm glad you brought that up because really the proof is in the pudding. If we want to know what happens when you supplement with these antioxidants, do you have a net gain or net loss? Tell me about some of the specific conditions that you've studied for tocotrienols and what the results have shown.
yeah, okay. Um, I'll mention the broad sweep ones, and then you can tell me which one you like to pick and choose to for me to elaborate.
Sure.
We initially had done probably 10 times more animal study, and then generally we found them to be good in the area of chronic condition, because if the vitamin E protect the cell, chronic condition, and the chronic conditions that we study, the cluster of metabolic syndrome. Sometimes that word doesn't mean much to other people. The cluster of metabolic syndrome are conditions that you hear medical doctors tell their patient, I think you, Mrs. Jones or Mr. Ju, you have pre-diabetes. I think you have type 2 diabetes, but your sugar is not high, is not good. Or the doctor will say, you have dyslipidemia, which means that your lipid in your body is high, referring to triglyceride or cholesterol, the bad cholesterol, like that. They're all lipids.
Yeah.
Sometimes the doctor may say, you are obviously carrying too much weight and it's beginning to be a serious burden to your body. So that could be another cluster of it. The other cluster, which is increasingly known to people now, would be non alcohol fatty liver disease. So I told you all the cluster, these are the chronic condition. We systematically study it, including overweight, obesity, and also postmenopausal women with osteopenia. So these are all the studies with that.
Yeah.
In terms of amount that we gave to people, different study we gave different amount depending on the severity of the cases of studies we had.
Mhm.
Uh, on normal, healthy elderly subject 60 to 65 years old, they don't have any condition, they're relatively squeaky clean, so we gave them something like 100 to 150 milligram, so as an antioxidant protection because they're growing older. We have
Mhm.
that. And then to mild conditions like pre-diabetes or early onset diabetes, earlier stage, then we give them something like 200 to 300 milligram, like that. And then on more serious condition like clearly have established fatty liver disease, then they're more like 400 to 600 milligram, like that. And only in studies that we are doing in Denmark, which are
Mm.
on stage 4 cancer patient, then they take a 900 milligram. So that will be
Mhm.
the highest dose, but most time people need approximately more like about 2 to 300 milligrams. So that's my big sweep from the range of what to take based on the clinical studies that we made. So,
Yes. Okay, this was perfect. So it sounds like you've done a number of studies in humans, and you found that if someone's relatively healthy and they want some protection against inflammatory related conditions, they should take around 100 to 150. But then if they've had some of those, a diagnosis around metabolic syndrome, so like prediabetes or diabetes, dyslipidemia or high cholesterol, high triglycerides, non-alcoholic fatty liver.
mhm,
Well, actually, you put that as a higher dosing, but the other metabolic syndrome is a high BMI or overweight or obesity. Then sitting closer to 200 to 300 milligrams, fatty
mhm,
liver more like 4 to 600.
mhm.
And then stage 4 cancer, you've done some studies around 900 milligrams, and this is all tocotrienols, correct?
This is all
No.
tocotrienol. No other like that. Now, if people want to know if that is too little, too much, or somewhere in between, in
Mhm.
many of the early vitamin E, as in alpha tocopherol clinical study,
Mhm.
their typical dose is about 400 milligram, And
Mm,
then I've seen some 1,000 milligram and some 2,000 milligram or even higher. So they are
mm,
much higher. So we do not believe that tocotrienol need to be that high. So
mm,
so that's why if you use the average one, it's about 200 perhaps or 300 milligram perhaps, and we found
mm.
that to be adequate. The cancer study is unique because the cancer have grown all over the body and there are no other available option. So we use the highest dose to see if the tocotrienol would kill the cancer or not. Most of us are not in that situation, so the amount needed would be much less.
Okay. I'm so glad we brought this up because when I was preparing for this, I looked at some of the multivitamins that we use in our practice fairly frequently. And so, for example, I saw the brand that you have on your website is this Designs for Health
Mhm.
brand, and they carry like the vitamin E, and this is tocotrienols. But then I did see there was one that we do sometimes use that has tocopherol in it. So
Mhm.
you've really helped me understand the importance of taking a closer look at that, and then also the dosing, like in this one, it's actually only 15 milligrams because it's
Yeah.
a full multivitamin, which probably isn't gonna do really much of anything, whereas, like, I saw on your website, you carry their annatto, products that have more of, like, that therapeutic dosing that
Yeah.
you're talking about. Is that
Now
right?
let me answer that piece. I partner with Design for Health. That bottle you just held up, Primal Multi, that's a multivitamin.
Mhm,
If you look at I have not taken multivitamin for 20 years. I refuse to take them because they have alpha tocopherol
mhm.
on the vitamin E piece. There are many other
Yeah,
stuff because it's multi.
yeah,
And then when I start talking with Design for Health, and they were making the Anato E, they have 150 milligram denomination soft gel, and they have 300 milligram denomination soft gel, depending on the utility. Then I noticed in the Primal Multi, they have their vitamin E is alpha tocopherol. I said that, would you care to remove the alpha tocopherol vitamin E piece in your multi, and you should put it with tocotrienol. The reason that they have about 10 or 15 milligram is because the 100% RDA, 100% recommended daily allowance of vitamin E on the multi is about 10 to 15 milligram. So they just put in the 100%
yeah.
multi. So now that they put that in, then I have been consuming in the last two. So if a very busy mom or very busy dad that don't have time to do taking this an arsenal of things, then that Design for Health Primal Multi is a good place to start. I
Okay,
take that and it really helps me. However, for me, I need this is me as in Barrie Tan. I need it more because I have genetic hypercholesterolemia,
mhm,
meaning even though I'm small size and weight and I don't eat ridiculously, I still produce a lot of cholesterol, and high cholesterol can get oxidized and may not be good for me. And so I take Deonato E tocotrienol to help me to modulate my inflammation and to help me to reduce my cholesterol. It reduced my cholesterol about 10%. Not fantastic, but 10% something. Give me, but it reduced my inflammation, which you had asked. When we had done study on people with lipidemia and pre-diabetic, one of the outstanding feature is that their C-reactive protein drop. We
mhm,
consistently see it. So when person have a lot of stressful life, or their body is carrying a little bit too much weight, or it's
mhm.
a lot of other stuff, emotional thing, our body play on each other, you know. So we have that, and anything that can help us to contain our inflammation is a good thing. And lowering C reactive protein is what we consistently see, whatever the conditions that we happen to be studying. That's
Yeah,
correct.
yeah. I'm just thinking about the way that you shared with me that these tocotrienols are going to implant there in the cell membranes,
Mm-hmm,
and so it makes me wonder if, like, say I do say some one of my patients has pre-diabetes or they have dyslipidemia, which are things we
mm-hmm.
see basically every day. Let's say I tell them, okay, I'm going to give you the 300 milligrams Anato E supplement. Is there some kind of like at first they're going to be getting a lot of that starts to go into their membranes, and then is it almost like you need some kind of loading dose, or you need to taper off or like lower your dose over time because you kind of reach some type of like concentration where it's like you don't need the same dosing? Or is that something that's known from any of the research that you've done, or would you recommend just kind of staying on that dose consistently, like ongoing?
I see. Yes, I have. Good question. That question there refers to loading. If a person have not taken this before, they may start taking initially 300 milligram for about a month, because we
Mm,
have about 30 or so pounds of fat, and then you'll begin to deposit in the fat. And then
yeah.
after 1 month, they can go half on the loading from 300 to 150, like that. I would
Oh,
say an exception of not changing and lower the dose would be they clearly have a family history of,
yeah.
such as family history of breast cancer, or family history of a fatty liver conditions, like that. While I'm talking about the fatty liver condition, let me just digress, and I think it's an important one.
Yeah.
Oftentimes, we are not careful or self-aware of the amount of food that we eat. I am now live in America for more about 45 years or so. So I cannot say in earlier days I'm an immigrant here and American food are terrible. I can't do that. So this is my
No
country.
more free pass.
There is no more free pass. So this is my country now, right? So I can so I start to think about, I don't really know, in a country that have reasonable amount of wealth. I some people may say that we are not. If you have a chance to visit some other country, we are really
Oh,
privileged of what we
yeah,
have in this country. And since you are a military spouse, you will know when you travel some other places, we are
yeah.
very privileged in this country, like that. So, and with privilege, we sometimes take things for granted. I don't think that we need to eat the huge entree of food put on it. It's just way too much. We
Mm,
can't burn it up. So, and if we
yeah.
can't burn up, we stash away somewhere as fat, that it's just too much. So I think if we are self-aware of the volume of food we eat, and also the kinds of the food that we eat, I think would be, because time doesn't permit us to explore this, I would simplistically say more vegetable is never going to hurt you.
Yes.
And fruit will be good. Lesser red meat is not going to hurt you. Who wouldn't like great tasting meat? I'm not a vegan, not a vegetarian like that. But as we grow older, that's hard. And just meat and potato is not going to cut it when we grow older and older. And this is what actually the U.S. government did a study, and the audience can go online. There is a town called Framingham. It just happened to be in my state, Massachusetts. It's Framingham, Massachusetts. Now it's not like a little a Joe town out in the sticks, but in the 1950s, that was a town, a Joe town
Yeah.
out in the sticks. But right now, Framingham, Boston have expanded into, and Framingham is kind of like, it's not a no-name town anymore, but they are continuing the study into the fourth generation. So they
Yeah.
study your little town, and then what? And it was in that. If you ever go to Boston, go to Framingham Heart Association, Heart Foundation, and study. They're studying people in that community for the fourth generation, and it was there they found that high cholesterol causes arteriosclerosis, smoking caused bad situation, and they found out diabetes. They found out many things. They actually studied the whole population. No drug company going to invest like that. The U.S. government did, and sometime you can go on Time magazine. Actually, it's pretty cool. They had a picture of an older lady, a younger one, and a younger one, and a baby. So they show you the four generation of the same family
Oh,
that
cool.
were
I haven't
involved in
seen
that
that.
study. And that
That's cool.
study disclosed a lot of stuff, mostly on dietary thing, and
Mhm.
and that and that is paid for by the U.S. government. Is worthy. There are no funny side thing. This and that is for this group of people or that group, or some other conspiracy. They're just studying people,
Yeah.
and what is good and not good. I found that to be very important like that. And
Yeah.
from that, I found that, people have oxidative damage that cause inflammation, and depending on what parts of the body and that part of the body would be expressed, it was because of that. In the last of a big group of study, we studied the fatty liver disease.
Mm.
The fatty liver disease, if you Google, is called NAFLD. It just acronized for non-alcohol fatty liver disease. NAFLD is very awkwardly put name of a disease
Yeah.
discovered in Mayo Clinic only in the 1980s. I decided to zone in on this because the liver is the single largest organ like that. And even from the name of the disease, who would have guessed 30 years or 40 years ago, you can have somebody's liver so badly damaged, like it is damaged by alcohol cirrhosis. I
Mhm.
say that again. Who would have guessed 30, 40 years ago somebody would have found out that a person's liver could have been damaged like alcohol cirrhosis, but they had nothing to do with alcohol and had to do with the huge amount of funny foods or cheap foods that we eat that
Yeah.
damage our liver. And hence the disease actually is specifically called to differentiate from alcohol, non-alcohol
Yeah.
fatty liver disease. And we decided to study that. We did a 3-month study, a 6-month study, and a 12-month study. The shorthand on the study was in a 3-month study, we were checking liver enzyme, the liver enzyme dropped. And the second one, we studied inflammation, it dropped. And then the antioxidant enzyme, the endogenous enzyme increased. And then we also study steatosis, like
Mm.
the ultrasound you watch for the fetus in the mother's baby,
Mm.
like that. And
Mm.
then you can watch the fat, and the fat is reduced from the liver. So I said, wow, this is cool. In a 6-month study. And then in the 12-month study, we did all of those, still work. Then we decided to do CAT scan and actually able to see any fibrotic scar. If the liver stashed too much fat, then the fibrosis would happen. And then we saw that the fibrosis will also reduce. Then in all of this, these are all our primary finding. We have a secondary finding, and I thought that I'll say this last. We noticed it in the 3 months, but I did not want to say anything. We noticed it again in the 6 month. Then I said, wait a minute, I got to pay some attention. So in the 12-month study, I decided to do this. And the shorthand is in the 3, 6, and 12 months, the fatty liver patient lost about 10 to 15 pounds of weight.
Oh,
I didn't
wow.
want to say that, Aaron, initially because people are going to just vainly just grab on that and say that this is a weight loss product. I don't, weight loss
It's
product
a
usually
metabolic health
connect.
product.
Yeah,
Yes.
they lose weight within a month. But we did not, our shortest time was 3 months, but it did. So other people encourage you, Dr. Tan, why don't you tell people that, yes, you saw weight loss, affirm it, but you saw weight loss at 3, 6, and 12 months because that's what we saw. It was not
Yeah.
at 1 month. We think that it's not in and of itself a weight loss product because we didn't see anything in the first 2, 4 weeks. Instead, their metabolism is
Yes.
out of kilter, comes back into balance, and as a consequence of that metabolic balance, their body lower inflammation and the weight comes back to normality. Then I said, if that is the case, then the tocotrienol is a wonderful anti-aging thing. If you just simplistically say it, if not, what is there not to like? If a
Yes.
person has fatty liver and then they lose about 10 to 15 pounds. So I'm really grateful. This is published. So I didn't even expect this finding. I expect all the other findings I mentioned,
Yeah.
but not this one. So if there to be one great take home would be since fatty liver is one of the major cluster of metabolic syndrome beside type 2 diabetes and pre-diabetes, then taking it as a self-protection for us is a wonderful thing.
I totally that makes sense to me. We have a whole weight loss program that's all centered around, the way you actually reverse problems with your weight is you get your metabolism healthy, and there's 4 pillars to that, and one of the 4 pillars is lower your inflammatory status because that's the mechanism whereby appetite becomes dysregulated and energy intake becomes off kilter. And so it makes sense that when you're taking something that's such a potent anti-inflammatory, you're going to have that improvement of your metabolic health, your appetite signaling, and then a natural lowering of your weight over time. So that's pretty cool. And I know we have to go, but and we could talk for so long, but very quickly, maybe give me the just short list of like, I know people are gonna be super excited to check out like on your website. You've linked to the tocotrienol products, but can you tell me just maybe the top 3 to 5 foods that people can also try to increase in their diets that have some tocotrienols?
I answer this way. We first discovered tocotrienol in rice and palm
Hmm.
before annatto. Rice would be in rice bran. If you eat brown rice, you have a small amount of it.
Hmm.
50% tocopherol, 50% tocotrienol, half half. And
Hmm.
then if you eat palm is a saturated fat, and some people don't like it because it's tropical fat, and we didn't like it. So that could be arguable. But if you have palm oil, it's about 75% tocotrienol and 25% tocopherol. And we
Okay.
found that tocopherol interfere with the function of tocotrienol, even though I discovered that. So I kind of
Yeah.
stopped that study for a while. And then I found this from annatto, this lovely plant here. See
Hmm.
that? This
Yeah.
lovely plant here. We use annatto for coloring cheeses. I removed the color, and that's when I found the tocotrienol, vitamin E that protect the color and maintain the color. If you
Mhm.
wanted to get this and do some home cooking, that contain the tocotrienol. They are typically ethnic fare of Hispanic food. You just go on
Mhm.
YouTube, they have it. It make the food look reddish. So if you cook rice, you have it, and you pound it and you make tortilla chip, a tortilla, and then the tortilla will have sparkle red like this. Okay,
Wow.
but if you keep it, American mostly just use the annatto for coloring cheese, Dorito chips, and things that give you the yellowish orangey hue. But they may contain small amount of tocotrienol. Otherwise, pistachio, macadamia nut, they are
Oh,
not
wow.
a normal food that we consume every day. Probably on the American diet, consume food every day would be corn oil. I'm a little bit skittish about taking a lot of corn oil because it's an industrial oil. I rather people use olive oil, which is a good, okay cooking oil, or use avocado oil, which is good. High flash point is good for if
Yeah.
you have to use high temperature like that. I do stir fry because I'm Chinese, stir fried at home. So I usually use avocado oil or olive oil. So if I use any other good oil, I don't use it for cooking, only for salad dressing because they're not good, Like for example, nobody uses fish oil for cooking. It'll be bad news.
Yeah.
We should consume fish oil, but not do it.
Yes.
I just usually just consume fish. I take a fish oil supplement, and when I take the fish oil supplement, I should be taking tocotrienol to protect the fish oil from going bad inside my body.
Yes.
So that piece. So I would say that if the audience want more information, I know we're coming to the end here. You can download the free book that I have here. It's called The
Which
Truth About Vitamin E, and my
wonderful.
my company's name. It's free. I did it for I described how I discover the tocotrienol from this plant, and you can download it using this Barrie Tan .com/book,
Uh-huh.
and it may say mention Erin, so that it come through you to this podcast, and you can download from that book, or you simply type American River Nutrition. And I like to say at the end, I was not born in this country. My wife is American, and so are my children. But I'm very grateful to be here, and we make this. We have many chance to make this elsewhere. I never did. I made it right here in Massachusetts, like that. So this is one of the wonderful thing. We discover this, we make this, and I want this to benefit people's health so that we will have the quality of life as we grow older to have with our children, grandchildren,
Yeah.
and all the other good things to come. So thank you for all you folks listening and your service to our country. I think that is not, for me, is not taken for granted. So I'm very grateful.
I'm so grateful to you, Dr. Tan, and I'm genuinely I thought I was at my peak of fascination and obsession with fat soluble vitamins, but you've just taken me to the next level. And I'm sure that everybody listening is just can't wait to learn more. And so we definitely will link to your book, your website, and our and your practice in our show notes so that people can come and download your ebook. They can check out the Anato e products that you have listed for your people to look at. You've helped us
Yeah.
with exactly the specific ways that we can think about dosing that. So that's really helpful. And so I'm sure that you've benefited a lot of people with this interview, and I'm very grateful.
Wow, thank you. And also in the future, when we come back to another interview, I found another compound also from annatto, and that compound is an endogenous nutrient in our human body, had many, many
Ooh,
benefits. So if you want a sneak preview, when you come to the American River Nutrition website, there will be one part they say GG Go. The letter G Go,
okay,
GG, it acronizes for Jaranol. You can read it and then maybe make sure, Erin, when we leave each other, do the Jen that helped me to set up has your email, like that. If not, can you send me an email? My email is Barrie, Barrie at American river.com.
okay, I
So
will.
yeah, send us an email so we can get connected when the GG data comes out. Then you may have
Wonderful.
another interview, maybe this time next year or something.
I would be so delighted. I
Yeah,
can't wait. Thank you
yeah.
so much.
Thank you so much. Have a wonderful holidays and all that mean to all of us. Thank
Thank
you.
you. You as well.